Hello, my name is Maddie. I'll be your RN today. Could I get your name and date of birth? Great. So today we're going to be inserting a nasogastric tube. So the first thing I'm going to do is an assessment of your abdomen. So I'm going to lift this up and check for any distension, anything abnormal in your abdomen. Like a small balloon. Everything looks good here. Now I'm going to listen for some bowel sounds. If you're listening for bowel sounds and you don't hear any movement within 5 to 10 seconds, you're going to listen for 5 minutes. Okay, bowel sounds. So we're going to be checking labs before we can proceed with inserting the NG tube. So the first lab we're going to do is an NIR lab, which will tell you how thin the blood is. And then you're going to do a prothrombin, which is the time in seconds the blood takes to clot. A normal range would be 11 to 13.5. We're also going to do a PTT lab, which a normal range would be 30 to 45. This means if an abnormal longer PT time, it would mean that the clotting is taking longer than normal. So proceeding with this, our patient is normal in all of those labs, so we are able to insert the NG tube. So the first thing you're going to do is do your hand hygiene and put on some gloves. This is just going to be a clean procedure. We do not have to have a sterile field for this. Since your food isn't sterile, since your toothbrush isn't sterile, we don't need to have that. Just a clean work environment. So make sure your hands are clean and you have gloves. You're going to need the tubing, the irrigation tray, and some lubricant. So first I'm going to open the tube. There we go. Take the contents out. There we go. And now it's ready. Next, I'm going to open the irrigation tray. There's an alcohol prep pad, a syringe, and this to catch anything underneath. So we're going to open up the syringe, take this piece out. So next what I'm going to do is I'm going to take the tubing, and after I've explained the procedure to the patient, I'm going to measure from the nostril to the earlobe, and then the earlobe all the way to the xiphoid process, which is the end of the sternum. We have about 45 there, so that's about how far we're going to insert this tube. So nothing goes in this. This is just the filtration unit. Don't ever put anything in it. We're going to insert our syringe. You want it like this. And then we're going to grab lubricant. And we're going to alcohol prep pad everything, but just for this, because of the mannequin, we're not going to. We're going to dip in the lubricant. You're going to have the patient put their head back as far as they can. Just a little bit. Head up and up through there until you feel resistance. And now, since there's resistance, we're going to have the patient put their head down. And with every swallow of water, we're going to keep pushing. So we're going to have a drink and push in the swallow. Drink and swallow. Drink, swallow, drink, swallow, And we're about to the measurement that we made. After inserting all of our tubing and draping our patient, we are going to apply this to their nose and tubing in order for it to stay in. There we go. Also, we always use the right nostril because the right nostril is usually bigger on a human nose. That's why we insert it through the right nostril. So throughout this whole procedure of inserting the NG tube, you always want to make sure your patient is comfortable. If they are coughing, telling you to stop, stop for a minute. Just give them enough time to relax just a bit in order to make sure that the process is completely comfortable enough for them. We're going to check if we are in the stomach. So if we get stomach bile, perfect, that means we're there. If we get a white, filmy kind of color, we're in the lungs. That's not good. We need to remove it and put it in again. So here, we remove stomach bile, so we are in the stomach. So after we place the NG tube, we can put them back at a 30-degree angle. After inserting our NG tubes, we're always going to check for placement no matter what we do. So if we're coming in to feed them, we're going to check for the placement to make sure that it's still in the stomach. The most ideal way to check for placement would be a chest x-ray. Another way would be inserting the syringe, pulling out stomach bile, and inserting it back in. It has electrolytes that the patient needs. So for feeding, we're going to take out this cap for the syringe. We're going to have their food, insert the syringe, hold it above their head so gravity can make it go down the tube, and we're going to feed them. After all of their food has went down to their stomach, we're going to remove the syringe and proceed. We want to check to see if the patient has digested their food. We're going to insert the syringe and we're going to pull out. If there is undigested food, we're going to take it out and then we're going to document. So there's 170 ounces 170 ounces of food undigested. So what we're going to do is we're going to take this off, insert our syringe, and give it back to them. Let gravity do its work. Keep it up. There we go. Remove the syringe and put back the pieces. To give medication through our NG tube, we're going to crush all medicine that can be crushed. So in order to do that, we're going to crush our meds, put it in here, mix a little bit of saline, and give it to them. For each medication, you're going to do it separately. You're not going to do it all in one. You're going to do each one different. So we're going to take our syringe, pop the top off, insert it, and give each med. Just as we did feeding, we're going to hold it above. And then another med. And however many medicine, just remember, you cannot crush the ones that are not allowed to be crushed. They all have to be able to be crushed. There we go. Now we can remove the syringe and proceed. If we're going to suction our patient, we are going to insert an adapter and then insert it into our tubing. Then we are going to suction the patient for a few seconds. And then again. One more time. And then we're going to document the secretions that we've gotten. Every time you aspirate the stomach in order to check for your placement, because sometimes we're not always going to use a chest x-ray, even though that is the most important way to check for placement of an NG tube. We're going to aspirate the stomach when we cannot get a chest x-ray. So we're going to pull from our syringe, check this, we're going to note the consistency, we're going to check the pH, we're going to document every single thing that we see within this stomach file. We're going to give back to them. That's important. For removal of the NG tube, first we need to make sure we have a prescription to do it. We need to wait at least 30 minutes after feeding to remove this tube. So we're going to drape our patient again. We're going to give them an emesis bin. We can give them tissues, anything like that to make it more comfortable for them. So we can have a disposable bag. In this case, I'm just going to use this. And we are going to sit our patient up in a 90-degree angle. Make sure they're comfortable. Pillow behind their head, behind their shoulders. They need to be as comfortable as possible throughout this procedure. It's not a comfortable procedure. So after draping the patient, we're going to remove this. Be sure not to hurt the patient and pull out their skin. This shouldn't be that tight. And then for our removal, we're just going to have our patient relax and just start taking out as best as possible with a piece of gauze to catch the end. Then we're going to put our NG tube back in so the patient cannot see it. It's not nice to see, it's kind of gross. We can undrape our patient. If they need anything, we can always ask. We're going to document every single thing, everything you get from suctioning, everything you get from the tubing, the meds, everything. We can put them back in a 30-degree angle, and our procedure is done.